One of the most common questions we get asked is, do you have to take out your wisdom teeth? So Dr. Nate here again at Thrive Dental and Orthodontics, joined by my lovely wife, Dr. Christine. So let's get it straight. What do we need to do? Do we need to take out these wisdom teeth or not? Let's go through a couple reasons why you may want to, and then some reasons why you can probably keep them.
Okay. So the reasons why you want to take out a wisdom tooth is if they're causing gum disease or cavities because it's so difficult to keep it clean all the way back there, reaching all the way back there also. It could also be if the tooth is impacted and causing pain. Anatomically, there's something wrong there and it needs to be removed. Those are really good reasons to get them removed. And also, they're just kind of a pain to keep clean there and to maintain because it takes a lot of work and it's really hard to reach back there.
I know, I got my wisdom teeth out. I think you did.
I got all my wizzies out too.
Yeah.
Yep.
So, you know, for me, it wasn't necessarily that like I couldn't fully get back there, but there was coming in slightly, we call it horizontal at a tilt. And the problem is if you don't get rid of those teeth when they're coming in tilted, they start to push on the teeth in front of them. So we say your wisdom teeth push on those second molars and you may or may not get pain. It could be or could not be. But the problem is it actually starts to decay that second molar, which means that you may need to take out the wisdom tooth as well as the second molar.
Yeah, it's not worth keeping those if it's causing risk to the teeth next to it.
Exactly. So, but what are some reasons why you may want to keep those wisdom teeth in your mouth? So number one, I think this is the most obvious reason. You have lots of room. You know, you have maybe spacing all over the place. You have a big mouth, maybe some small teeth, and you're able to keep all those teeth in there. Why not keep it? Easy peasy.
And if you're really good at maintaining it, keeping it really clean, you could reach back there easily, then that's totally fine.
Right, yes, exactly. You're getting back there, keeping it clean. There's gonna be no risk of infection, no risk of cavities or crowns or all that good stuff. You may wanna keep it. Another reason why you may wanna keep it is maybe you've had other teeth taken out already, maybe a second molar taken out or maybe a molar taken out.
And you need that tooth in place of it, right?
And that's right, you need to use that tooth maybe for a bridge or some sort of a partial appliance or something. So you want to use that wisdom tooth as an anchor so you can have some sort of fake teeth in that tooth area that was extracted.
And sometimes that wisdom tooth can start to drift into the spot of that missing tooth and become kind of like the surrogate tooth for that spot.
That's right.
It's not the ideal situation. In some cases, orthodontists can straighten things out to make it work, but it's case by case.
And then probably one of the most kind of difficult to fully kind of articulate here in this video is if that tooth is too deep into your jaw and it's wrapped around the nerve. And you'll have oral surgeons or dentists talk to you about this. They'll probably show you some x-rays or show you, probably some panoramic x-rays. And they'll show you how the tooth is kind of wrapped around one of the nerves here.
And we don't want to risk damage to the nerve because that causes paresthesia, which the whole area gets numb. You don't want to damage nerves. You don't want to damage the arteries in those areas. If they're just too hard to get to and the risk is too high, then it's not worth it.
So I think, I know you had this actually yourself, that the nerve was kind of wrapped around that
slightly, it was kind of touching
around the wisdom tooth, and so you actually lost sensation
I did
for a little while.
For I think it was a couple months. It felt tingly and like kind of numb, and I was like a little nervous. I'm like, is this? And I think it affected my smile a little bit too, like my lower lip. And so I was nervous, but majority of those cases, the sensation does come back and things normalize. But if by some reason it had to be a surgical extraction and the nerve got cut or damaged, you know, to the point that's irreversible, then you're kind of screwed.
So that's why we say, you know, when we're showing you x-rays, we give you the pros and cons, and that's also why it's best to get your wisdom teeth out, say around the age of 18. Everybody's different, but around the age of 18.
16 to 21, they say, is like that perfect time to get it out. And instead of waiting till you're much older, because it's much more difficult to remove wisdom teeth when you're older because the bone is more brittle around that area. And you know, we just heal so much faster when we're just super young. So it's always ideal to get them out sooner than later.
So that's why when we're talking to you guys and you're like in your late teens, and this sometimes correlates with braces. You know, a lot of people getting their braces off when they're 16, 17, 18, and we say, hey, this is a great time to remove your wisdom teeth. We do that because we think it's going to help maybe keep the teeth straight. Maybe that's a comment for a different movie or a different video.
That's another whole nother topic.
But it's also the easiest time to heal up, and it's the easiest time to get them out, and that's why we do them at that time there.
Exactly.
Okay, so let's do a little summary of why you may want to keep your wisdom teeth or you want to maybe take them out.
Yeah, so you want to take out your wisdom teeth if you're having issues with maintaining your oral hygiene care, reaching those teeth. If there's gum disease or cavities that are forming because of this, or there's the risk of that, or if you have some sort of anatomical issue where the tooth is impacted and it's tilted the wrong way, causing pain, possibly infection, and other problems down the line.
Right, but you may want to keep them if you have enough space, or maybe you need that tooth as an anchor because you're having a missing tooth somewhere else, or potentially the tooth is just too darn down deep in your jaw,
risk is
and
too high.
it's right into your nerves and your blood vessels, and so we don't want to take them out because we're worried about maybe some paresthesia or some issues with your jaw.
We don't want to have to remove a ton of bone to get in there, because sometimes if a tooth is super impacted, then there's a lot of bone covering that tooth. So it's a lot of drilling that we don't want to have to do unnecessarily. So there's just some things you don't want to touch, but as long as the patient can maintain good oral hygiene care of teeth, and they have enough room in their mouth, and their teeth are, smaller and their mouth is larger, those are some more ideal situations. But I'd have to say it's not that often that you see that perfect case where it's ideal and it's okay for them to keep wisdom teeth. More often than not, it's always better to get the wisdom teeth out.
Right, that's why it's recommended so much at the year of 18-ish or so. So there you guys have it. So hopefully you guys know now if you should take out your wisdom teeth or if you should keep your wisdom teeth. And as you know, we're putting out videos every single week to help make you the best, most informed patient possible. If you have any questions or comments, please leave them below. Maybe please let us know. Do you have your wisdom teeth, or maybe you took them out, or do you have any more questions about your wisdom teeth? Just let us know, and we'll try our best to respond as best as possible. So we'll see you guys in the next video.